Hello, and welcome to A Sound Constitution here on CHLY 101.7 FM, a show where we focus on health topics important to our community. This year's team is made up of 8 third-year VIU nursing students. Our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable resources. All information provided on our show will be available in our show notes on our Facebook and Instagram pages. We want to remind our listeners that the information presented in the show is for educational purposes only and does not replace the advice of your primary health care professionals. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, Instagram at CHLY A Sound Constitution, Twitter at ASC_VIU, or email us at asoundconstitution@gmail.com. We would like to start off our episode by acknowledging that we are on the unceded territory of the Snuneymuxw people, the broadcasting range that overlaps the Kwatsan and Sliammon territories. This acknowledgement is done with gratitude to the Snuneymuxw people and with the intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding Snuneymuxw history, reconciliation, protocol, and land acknowledgement can be found on our Facebook, Instagram, and YouTube pages.
I'm Ashley, your host for today's episode, and I'm here with my co-hosts Tyler, Cassidy, and Ashley. Today's episode includes information about the new decriminalization of illicit drugs, some information about overdoses, a TED Talk from Celine Valerie, who is a lecturer in pharmaceutical sciences, a researcher, and a scientific consultant for the pharmaceutical industry, one about the dangers of mixing drugs, and another about how our body absorbs medications. A discussion about over-the-counter medications, vitamins, and natural health products, a bit of information about the scope of practice for pharmacists and how it has increased in the past few months. And later on, I will be interviewing David Forbes, the Director of Pharmacy for Island Health, and he will be sharing his opinion on all of the topics discussed. And our last segment will provide a bit of information about antibiotics and antibiotic resistance. Now let's get started with our episode. Did you know that an estimated 21% of Canadians, about 6 million people, will meet the criteria for addiction in their lifetime? More than 2/3 of the substance use costs are alcohol and tobacco related. Canada's most commonly abused drugs are alcohol, nicotine/tobacco, and cannabis. Illegal drugs and the abuse of prescription drugs are also serious issues for Canadians. 249 per 100,000 hospitalizations were entirely caused by alcohol. And smoking is responsible for nearly 17% of deaths in Canada. So let's talk about the decriminalization of illicit drugs and the opioid crisis. The information provided is from the BC government website. Adults in BC are no longer subject to criminal charges for the personal possession of small amounts of certain illegal drugs. Health Canada has granted an exemption from the Controlled Drugs and Substances Act to the province of BC from January 31st, 2023 until January 31st, 2026. The decriminalization of people who possess certain illegal drugs for personal use is a critical step in BC's fight against the toxic drug crisis. It will help reduce the barriers and stigma that prevent people from accessing life-saving supports and services. Substance use is a public health matter, not a criminal justice issue. Public health experts, police, and advocates have called for decriminalization, pointing to a range of potential benefits. Decriminalization has been implemented in many other jurisdictions, including Portugal, Uruguay, Germany, Lithuania, Australia, the Czech Republic, and Oregon, USA. Evidence suggests that decriminalization is an effective way to reduce the harms associated with substance use and criminalization. Decriminalization is not associated with increased rates of substance use. In Portugal, since decriminalization, rates of substance use and overdose deaths have remained below the European Union averages. Decriminalization is expected to provide cost savings to the criminal justice system. In Portugal, since decriminalization, the proportion of prisoners sentenced for drugs has fallen from 40% to 15%, and the substantial reduction in arrests and charges alleviates pressure on the criminal justice system. So what's changing? Under this exemption, adults 18 years and older in BC are not arrested or charged for possessing small amounts of certain illegal drugs for personal use. The illegal drugs covered by the exemption are opioids, such as heroin, morphine, and fentanyl, crack and powder cocaine, methamphetamine, and MDMA, also known as ecstasy. Adults found in personal possession of any combination of these illegal drugs that adds up to a combined total of 2.5 grams or less are not subject to criminal charges, and the drugs are not seized. Instead, they are offered information about health and social supports. This includes support with making a referral to local treatment and recovery services if requested. Although adults are not allowed to possess a combined total of more than 2.5 grams of these illegal drugs, or any amount of other illegal drugs not included in this exemption. This exemption does not apply to certain circumstances, such as adults found in possession of any amount of illegal drugs on the premises of elementary and secondary schools and licensed childcare facilities, at airports, and on Canadian Coast Guard vessels and helicopters. Some people wonder, how did we get here? When BC first applied for the exemption in 2021, it was 5 years after a public health emergency was declared due to a spike in fatal overdoses resulting from a poison drug supply. More than 10,000 BC residents have died since the emergency was declared in 2016. Politicians and advocates have argued that decriminalization of drug use would remove the stigma associated with it and treat it as a health issue instead of a criminal one. However, others have said that decriminalization will not stop people from dying, and only an accessible, safe supply of drugs would do so. One of the number one causes of overdoses is fentanyl. Fentanyl can be laced within drugs like cocaine, crack, ecstasy, and heroin, and people should be aware that drugs they get from anywhere other than a pharmacy or hospital may not be what the dealer says or believes they are. Fentanyl is a synthetic opioid that is more toxic than most other opioids. Opioids are a class of drug or medication that includes heroin, morphine, fentanyl, methadone, and codeine. Fentanyl is about 50 to 100 times more toxic than morphine, which makes the risk of accidental overdose higher. Fentanyl has medical uses and can be prescribed by a physician to help control severe pain, but in recent years has been produced in illegal labs and sold in the street, often mixed with other drugs. When fentanyl is mixed with other drugs, like other opioids, alcohol, or benzodiazepines, it can further increase the risk of accidental overdose, and there is no easy way to know if fentanyl is in drugs, and you cannot see it just by looking. People may be taking fentanyl without knowing it and putting themselves at risk for accidental overdoses. It is also important to be aware that drugs other than fentanyl can be lethal. 30% of the drugs overdose deaths in 2016 were not associated with fentanyl. Many overdoses were associated with combination of drugs and alcohol. An overdose may look different from one person to the next, but there are a few things you can look for if you think someone has overdosed on an opioid like heroin or fentanyl. Look for some of these signs. The person may not be moving, they won't be able to be woken, and they'll have slow and shallow breathing, or not breathing at all. They may have blue lips or nails, and they may be choking or making gurgling sounds or snoring, and they may have cold, clammy skin, and their pupils may be very tiny. If you suspect someone has overdosed, call 911 immediately. Time is of the essence. The Good Samaritan Overdose Act provides some legal protection for individuals who seek emergency help during an overdose. Here's an acronym to help you remember how to respond during an overdose. SAVE ME. S stands for stimulate. Check if the person is responsive. Can you wake them up? If the person is unresponsive, call 911. The sooner, the better. A stands for airway. Make sure there is nothing in the mouth stopping the person from breathing. Be sure to remove anything that is blocking the airway. V is for ventilate. Help them breathe. Plug the nose, tilt the head back, and give one breath every 5 seconds. E stands for evaluate. Do you see any improvement? Are they breathing on their own? If not, prepare naloxone. M stands for medication. Inject 1 dose of naloxone into a muscle. Learn about naloxone and how to safely administer it. E stands for evaluate and support. Is the person breathing? Naloxone usually takes effect in 3 to 5 minutes. If the person is not awake in 5 minutes, give another dose of naloxone. If you need to leave the person alone for any reason, place them in the recovery position before you leave to keep the airway clear and prevent choking. To put someone in the recovery position, turn them on their side, place their bottom hand under their hand for support, and place their top leg at a 90-degree angle to the body. So what is naloxone? Naloxone is a medication that can quickly reverse the effects of an overdose from opioids such as heroin, morphine, fentanyl, carfentanil, and codeine. Opioids are most often prescribed for pain relief, but in recent years, highly toxic synthetic opioids are being made in illegal labs. Naloxone is available without a prescription and is often given as an injection into the arm, buttocks, or muscle. It will only work on opioid-related overdoses, but will not cause harm if given to someone that has not overdosed on opioids. There are many resources that provide naloxone training. Be sure to take part in one so you can save someone's life. If you or someone you know is struggling with substance use, please be sure to reach out for help and support. If you are in a situation that involves immediate risk or harm to self or others, please call 911. For emotional support or assistance, a great resource is to call the Vancouver Island 24-hour crisis line at 1-888-494-3888. Our next topic is about medication interactions, over-the-counter medications, vitamins, and natural health products. To start off this discussion, we have a TED Talk by Dr. Celine Valerie. She is a lecturer in pharmaceutical sciences, a researcher, and a scientific consultant for the pharmaceutical industry.
Which of these three people is doing something risky? Is it the one who takes their cholesterol medication with grapefruit juice? The one who takes acetaminophen pain relievers for a sore ankle before going out for drinks? Or the one who's on a blood-thinning medication and takes an aspirin for a headache? Actually, all of them are. Each has inadvertently created a drug interaction that could, in extreme cases, lead to kidney failure, liver damage, or internal bleeding. Drug interactions happen when a combination of a drug with another substance causes different effects than either would individually. Foods, herbal supplements, legal drugs, and illicit substances can all cause drug interactions. Most drug interactions fall into two categories. Some take place when two substances' effects influence each other directly. In other cases, one substance affects how the body processes another, like how it is absorbed, metabolized, or transported around the body. Blood thinners and aspirin, for example, have similar effects that become dangerous when combined. Both prevent blood clots from forming. Blood thinners by preventing the formation of the clotting factors that hold clots together, and aspirin by preventing blood cells from clumping into groups that become clots. Individually, these effects are usually safe, but taken together, they can prevent blood clotting to a dangerous extent, possibly causing internal bleeding. While blood thinners and aspirin are generally harmless when taken individually, interactions where one substance exacerbates the effects of another can also take place between drugs that are independently harmful. Cocaine and heroin are each dangerous, and those dangers compound when the two drugs are combined, even though their behavioral effects may feel like they cancel each other out. Cocaine is a stimulant, and many of its effects, like increased heart rate, cause the body to need more oxygen. But heroin, a depressant, slows breathing, reducing the body's oxygen supply just when it needs more. This combination strains the organs and can cause respiratory failure and death. The interaction between grapefruit juice and certain medications in a class of cholesterol-lowering drugs called statins has to do with drug metabolism. The liver produces enzymes, molecules that facilitate the breakdown of substances that enter the body. Enzymes can both activate drugs by breaking them down into their therapeutic ingredients from more complex molecules, and deactivate them by breaking harmful compounds down into harmless metabolites. There are many different enzymes, each of which has a binding site that fits a specific molecule. Grapefruit binds to the same enzyme as statins, making less of that enzyme available to break down statins. So combining the two means that a greater concentration of the drug stays in the bloodstream for a longer period of time, potentially causing kidney failure. Alcohol can also alter the function of the enzyme that breaks down acetaminophen, the active ingredient in pain relievers like Tylenol and paracetamol. When someone takes acetaminophen, some of it is converted into a toxic substance. At the recommended dose, there isn't usually enough of this toxic byproduct to cause harm. But heavy drinking can alter enzyme activity so more of that byproduct is produced, potentially causing liver damage even with what's usually a safe dose of acetaminophen. Meanwhile, the herbal remedy St. John's wort increases the liver's production of a particular enzyme. That means the drugs this enzyme is responsible for breaking down get metabolized faster, sometimes too fast, before they can have their therapeutic effects. In spite of the dizzying number of possible interactions, most of the dangerous interactions with commonly used drugs are well known, and new developments in science are helping us keep better track of drug interactions than ever. Some researchers are developing AI programs that can predict the side effects of drug interactions before they occur, using information about the landscape of protein interactions within your body. For the new drugs that are being developed all the time, supercomputers are being used to find potential interactions while those drugs are still in development. When you take medicine, how does it know where it needs to go? Find out by following the path of medicine as it travels through the body in this video.
If you're just tuning in now, this is a Sound Constitution on CHLY 101.7 FM. Next, Ash is going to provide some information about over-the-counter medications, vitamins, and natural health products.
Thank you, Ashley. I would like to start this off by letting you know that the information provided in this episode does not replace the information provided by your healthcare provider. So what are over-the-counter medications? Over-the-counter medications are legally available without a prescription. Healthcare consumers consider OTC drugs to be low risk and use them to prevent, cure, or treat more than 400 different ailments. Some of the most commonly used OTC products include acetaminophen, aspirin, ibuprofen, antacids, and cough and cold products. So what types are available and where? Medicine is regulated by the Food and Drug Regulations. The National Drug Scheduling Advisory Committee of the National Association of Pharmacy Regulating Authorities sets out a professional intervention and advice necessary for the safe and effective use of drugs by consumers. Schedule I drugs are available only by prescription. Schedule II drugs are restricted access drugs available only from a pharmacist and are retained in the area behind the counter where there is no opportunity for consumer selection. An example is insulin and acetaminophen with codeine. This ensures that the consumer is not self-medicating inappropriately and the use of these drugs is subject to counseling by the pharmacist. Schedule III drugs include pharmacy-only non-prescription drugs, meaning the consumer has open access to Schedule III drugs and a pharmacist is available to answer any questions. Some examples would be antihistamines and ulcer medications. Then we have unscheduled drugs. So these are available to everyone at the pharmacy. This is an example is ibuprofen, acetaminophen, nicotine gum, antacids, cold and cough medications, vitamins, or minerals. So even though these drugs are available through the pharmacy and are available to everyone, that does not mean that they are safe. So why could they be a potential hazard? So over-the-counter medications may postpone effective treatment of more chronic disease states. They may delay treatment of serious or life-threatening disorders. They may relieve symptoms of a disorder, but not the cause. They can lead to toxicity and possible interactions with current prescription medications, and there is a potential for misuse. So even though over-the-counter medications are readily available to anybody at the pharmacy, they still aren't considered safe. So why would they be a potential hazard? So over-the-counter medications may postpone effective treatment of more chronic disease states. They may delay treatment of serious or life-threatening disorders. They may relieve symptoms of a disorder, but not the actual cause. They can lead to toxicity, cause possible interactions with current prescription medications, and there is a potential for misuse. An example of a medication that can cause a life-threatening situation is actually aspirin, as it should not be given to children and teenagers with viral infections due to the association with Ray's syndrome. It is thought that aspirin might be a trigger for this rare but serious condition that causes severe swelling of the brain and liver. So let's talk about vitamins. They can be put into two different groups. So we have vitamins A, D, E, and K, which are considered fat-soluble vitamins, which essentially means they can be dissolved in fat. So these vitamins are stored in the liver and fatty tissues, so extra dietary intake isn't required unless a deficiency is present. Now, because these vitamins are stored in the body, it increases the risk for toxicity when you take high doses. Then we have water-soluble vitamins, which are vitamin B complex and vitamin C. So if taken in excess amounts, it is excreted through the urine, so it's not stored in the body. And toxic reactions can be very rare depending on the amount of vitamin that was taken. So we have vitamin A, which is the fat-soluble vitamin that is stored in our body. It is used topically to fight acne as isoteratonin and orally to treat deficiency. So concurrent use of isoteratonin and vitamin A ingestion can result in additive effects and possible toxicity. Toxicity symptoms include irritability, drowsiness, vertigo, delirium, coma, vomiting, diarrhea, and topically, it can cause generalized peeling of the skin. Vitamin D is needed for normal calcification of bones and teeth. It also works with the parathyroid to regulate the absorption of calcium and phosphorus. If it is taken in excessive amounts over a long period of time, it can lead to toxicity. Some symptoms are nausea, vomiting, high blood pressure, decreased bone growth, and eventually kidney impairment. Then we have vitamin B6, which is a water-soluble vitamin. So this is needed to maintain the integrity of your nerves. If you take extremely high doses, it can actually cause serious neurological damage. So then we have vitamin K, which I think is really important to talk about because it's essential for blood coagulation factors in the liver. So vitamin K can actually reverse the effects of certain anticoagulants, known as warfarin. For any of you who don't know, anticoagulants prevent the blood from clotting, which increases the risk for prolonged bleeding. Some other non-healthcare products that cause bleeding are garlic, ginseng, green tea, feverfew, aloe, cranberry, turmeric, chamomile, grapefruit, oregano, and flaxseed. Now I'd like to elaborate a bit more on the grapefruit juice. So as little as 250 milliliters of grapefruit juice can change the metabolism of some drugs, meaning more of the drug can enter the bloodstream and stay in the body longer, which can lead to toxicity or overdose. Another non-healthcare product that I brought up that can cause bleeding is actually garlic. Now, garlic can actually also interfere with hypoglycemic therapy and the anticoagulant, which is warfarin. Another one that I actually found really interesting was saw palmetto. Now, it actually changes the effects of hormones in contraceptive drugs, patches, or hormone replacement therapies. Also, did you know cranberry can decrease elimination of many drugs excreted by the kidneys? I actually thought that one was pretty interesting. And next we have St. John's wort, which can lead to serotonin syndrome when used with serotonin reuptake inhibitors, which are also known as antidepressants. So serotonin syndrome is basically your body has too much serotonin and it is potentially life-threatening. Another non-healthcare product that I thought was interesting was echinacea. So echinacea can actually interfere or even counteract antivirals. So overall, if taken as directed by a healthcare professional, over-the-counter medications can be safe. If you take any of these over-the-counter medications, always be sure to tell your healthcare provider of all the supplements taken at home to ensure your health and medication safety. I just want to remind you that any information provided today does not replace the information given by your healthcare provider. Thank you for listening, guys, and I hope you're having a great day.
Hello, and welcome to the 4th episode's pop quiz. Which of the following vitamins helps us see in the dark? A. Vitamin B6, B. Vitamin C, C. Vitamin A, or D. Vitamin D2? You have 10 seconds to think about the answer. And it is C, vitamin A. Vitamin A helps support the retina in our eyes by supplementing the creation of the protein rhodopsin. Rhodopsin is the primary contributor to the light absorption on our retinas, which will assist us in seeing in the dim lighting. Vitamin A can be found in dairy products, carrots, dark leafy greens, eggs, and dark orange fruits. Taking excess vitamin A can lead to nausea and vomiting, vertigo, and blurry vision. Having low amounts of vitamin A can lead to blurry vision, dry eyes, poor wound healing, and acne and breakouts. The best way to ensure you're intaking enough vitamin A is to have a well-rounded diet with a healthy mix of fruits and vegetables. Now that's all for this quiz. Back to the episode.
Our next segment goes back to Dr. Celine Valerie, a lecturer in pharmaceutical sciences, a researcher, and a scientific consultant for pharmaceutical industry. This is a TED Talk about how our body absorbs medications.
Have you ever wondered what happens to a painkiller, like ibuprofen, after you swallow it? Medicine that slides down your throat can help treat a headache, a sore back, or a throbbing sprained ankle. But how does it get where it needs to go in the first place? The answer is that it hitches a ride in your circulatory bloodstream, cycling through your body in a race to do its job before it's snared by organs and molecules designed to neutralize and expel foreign substances. This process starts in your digestive system. Say you swallow an ibuprofen tablet for a sore ankle. Within minutes, the tablet starts disintegrating in the acidic fluids of your stomach. The dissolved ibuprofen travels into the small intestine and then across the intestinal wall into a network of blood vessels. These blood vessels feed into a vein, which carries the blood and anything in it to the liver. The next step is to make it through the liver. As the blood and the drug molecules in it travel through liver blood vessels, enzymes attempt to react with the ibuprofen molecules to neutralize them. The damaged ibuprofen molecules, called metabolites, may no longer be effective as painkillers. At this stage, most of the ibuprofen makes it through the liver unscathed. It continues its journey out of the liver, through veins, into the body's circulatory system. Half an hour after you swallow the pill, some of the dose has already made it into the circulatory bloodstream. This blood loop travels through every limb and organ, including the heart, brain, kidneys, and back through the liver. When ibuprofen molecules encounter a location where the body's pain response is in full swing, they bind to specific target molecules that are part of that reaction. Painkillers like ibuprofen block the production of compounds that help the body transmit pain signals. As more drug molecules accumulate, the pain-canceling effect increases, reaching a maximum within about 1 or 2 hours. Then the body starts efficiently eliminating ibuprofen, with the blood dose decreasing by half every 2 hours on average. When the ibuprofen molecules detach from their targets, the systemic bloodstream carries them away again. Back in the liver, another small fraction of the total amount of the drug gets transformed into metabolites, which are eventually filtered out by the kidneys in the urine. The loop from liver to body to kidneys continues at a rate of about 1 blood cycle per minute, with a little more of the drug neutralized and filtered out in each cycle. These basic steps are the same for any drug that you take orally, but the speed of the process and the amount of medicine that makes it into your bloodstream varies based on drug, person, and how it gets into the body. The dosing instructions on medicine labels can help, but they're averages based on a sample population that doesn't represent every consumer. And getting the dose right is important. If it's too low, the medicine won't do its job. If it's too high, the drug and its metabolites can be toxic. That's true of any drug. One of the hardest groups of patients to get the right dosage for are children. That's because how they process medicine changes quickly, as do their bodies. For instance, the level of liver enzymes that neutralize medication highly fluctuates during infancy and childhood. And that's just one of many complicating factors. Genetics, age, diet, disease, and even pregnancy influence the body's efficiency of processing medicine. Someday, routine DNA tests may be able to dial in the precise dose of medicine personalized to your liver efficiency and other factors. But in the meantime, your best bet is reading the label or consulting your doctor or pharmacist and taking the recommended amounts with the recommended timing.
And if you're just tuning in, this is Nursing Group B of a Sound Constitution. Stay tuned and find out what your pharmacist can do for you.
Next, Tyler's going to tell us a bit about the increased scope of practice for pharmacists in our community.
Mentioned previously in the episode, there is an increase in scope of practice for pharmacists coming later in spring 2023. I will be covering what this increase of scope will allow pharmacists to do, how it will affect the general public, and how this change will shift healthcare overall. Announced in September of 2022, pharmacists will have an increased scope of practice coming in spring 2023. This increase in scope of practice will allow pharmacists to prescribe medications for minor ailments as well as contraception. So, you might be wondering, what is a minor ailment? Minor ailment at the current time of recording this is described as being a urinary tract infection and conjunctivitis, which is commonly known as pink eye. A urinary tract infection is a bacterial infection of the urinary system. Most common areas that are infected are the urethra and bladder. If the infection is left untreated, the kidneys may become infected, which can quickly lead to infection of the bloodstream. This infection of the bloodstream is classified as sepsis and requires urgent care. A urinary tract infection is more common in women than men, due to women having a shorter urethra. The symptoms for a urinary tract infection include painful or burning sensation when urinating, blood-tinged or cloudy urine, feeling the constant need to urinate, lower back pain or pressure, fever, and fatigue. Conjunctivitis or pink eye is a bacterial infection of the conjunctiva. The conjunctiva is the thin mucous membrane that lines the inside of the eyelids and covers the sclera. The sclera is the white portion of the eye. Most symptoms include red eye, irritation or itching sensation of the eye, watery eyes, which may include yellow or green discharge, light sensitivity, blurred vision, and in severe cases, eyelid edema. These minor ailments require hasty antibiotic treatment, and with the shortage of physicians, coupled with the lengthy wait times at clinics and emergency departments, people are left in prolonged discomfort and pain. With the increase in scope on the horizon, these wait times will be a thing of the past for minor ailments. With the shortage of physicians in our communities throughout Canada, this slight increase in scope for pharmacists will alleviate some of the stress put on walk-in clinics and emergency departments. Decreasing this stress will in turn shorten wait times overall. This will be a monumental change within our healthcare system. The only two professions that are legally allowed to prescribe medication at the time of recording this are nurse practitioners and physicians. Having a third healthcare professional prescribing medications will greatly increase the access to much needed care.
Did you know that Tylenol, also known as acetaminophen, is the most common drug ingredient found in more than 600 different over-the-counter and prescription medicines, including pain relievers, fever reducers, sleep aids, and numerous cough, cold, and allergy medicines. When used as directed, acetaminophen is safe and effective, but there is a limit to how much acetaminophen you can take in one day. Taking more than directed is an overdose and can lead to liver damage. Here's some tips for using acetaminophen safely. Always read and follow the label. Never take more medicine than the label says. Taking more acetaminophen than directed is an overdose and can lead to liver damage. Know if your medicines contain acetaminophen. It is important to check the active ingredients listed on the labels of all your medicines to see if they contain acetaminophen. On over-the-counter medicine labels, the word acetaminophen is written on the front of the package or bottle and is highlighted in bold type and in the active ingredients section of the drug facts label. On prescription medicine labels, acetaminophen is sometimes listed as APAP, or other shortened versions of the word. How much acetaminophen can you take at once? Take only one medicine at a time that contains acetaminophen. You can take too much acetaminophen if you use more than one medicine that contains acetaminophen at the same time. Ask your healthcare provider or pharmacist if you have any questions. I'm Ashley, and I'm interviewing David Forbes. He's the Director of Pharmacy for Island Health. I'm going to be asking him a few questions about his experience as a pharmacist, a bit about the scope of practice as a pharmacist, and a bit of questions about the topic of decriminalization of the illicit drugs that has recently happened. So my first question is, can you tell us a bit about your experience as a pharmacist and your position now?
Sure. So I've been a pharmacist for over 30 years now. My career has exclusively been in the hospital and health authority systems. And for the first half of my career, I worked primarily as a clinical pharmacist. So that's the pharmacy service that involves working with interprofessional teams providing direct patient care and ensuring that the medicines are doing what they should. So we have to take into account various patient factors and the other medicines they're on and so on. For the past 10 years or so, I've been more in management roles. So I was the manager for clinical pharmacy in Island Health for about 10 years, and then just recently in the past year I've become the director of pharmacy for Island Health. So now I have to also concern myself with a lot of the drug delivery and packaging and preparation systems that weren't really a part of my previous role. So it's fairly exciting.
Yeah, sounds like a lot of responsibility. Can you explain exactly what does a pharmacist do?
Well, there are variable things. Most pharmacists now, and I'll speak mainly for the health authority system, are clinical pharmacists, so integrated on interprofessional care teams, working with prescribers and nurses particularly to ensure that medications are doing what they should and managing the risks associated with medicines. But we also have pharmacists still involved in some of the drug distribution processes, but that is primarily managed by pharmacy technicians now, who are now a regulated profession under the College of Pharmacists. And we also have pharmacists involved in many other things related to medication use. So we have pharmacists in our informatics arm. We have pharmacists that are involved in some of our information services, maintaining drug formularies, editing and developing IV monographs, and providing education to other professionals. So it's a diversity of things. Okay. And at the within the medication system, pharmacists are required to review and sign off on all orders. So even if we're not up on the care team, we still have to have a process where there's a pharmacist reviewing every order that's placed by physicians or nurse practitioners.
Okay, awesome. How has the scope of practice for a pharmacist changed in the past few months?
Well, recently, I believe the announcement was on September 29th of last year, 2022. The ministry announced that the scope of pharmacists would be expanded to include the ability to refill prescriptions that had run out of refills without a specific authorization from a physician. And as well, upcoming, we're going to be seeing that pharmacists will have prescribing authority for a set of minor ailments. So they'll actually be the prescribing professional in that circumstance.
Okay, interesting. Can you explain a bit about why you think the scope has changed and if you think it'll be effective?
Yeah, the primary reason is access to care and the stresses on our primary care health system. So I think everyone knows that it's often difficult to get a family doctor. So many people do not have a family doctor. And primary care clinics tend to be very busy. So if there's a component of that care that can be taken over in another setting, then certainly it's something to consider. So in the case of refills, having a pharmacist who's able to refill a prescription for someone who's doing well and is stable on a particular therapy means that the person doesn't have to phone a physician and get them to spend the time providing that refill. Similarly, for minor ailments, in many cases it's something that the diagnosis is fairly clear or has been provided, and the person can walk into a pharmacy and then get an appropriate medication prescribed, which means that people with these minor ailments don't need to go to walk-in clinics or primary care clinics or emergency departments. So that volume of workload is essentially redirected.
Okay.
And will it be effective? Well, that remains to be seen. So the change in scope will be evaluated. So what does it mean to be effective? It means that the expanded scope is used and people are successfully managed by their pharmacist, and this is primarily in the community setting, in drugstores and such, and that the prescribing activity of the pharmacist is effective and that people are appropriately treated and aren't experiencing any more harm than they would if they were being treated by a primary care physician or a nurse practitioner.
Yeah. Okay. How can we maintain continuity of care with a patient's GP? What kind of communication will occur? Will it be up to the patient to communicate with their GP?
No, it will be important for the pharmacist to communicate with the person's primary care provider, assuming they have one. And so that can be with clinical notes, and that can be sent to the office like many other consultants do when they provide care to someone. There's generally communication to the primary care provider of the findings and the treatment recommendations and what was told to the person, so that primary care provider is aware of what's going on. I think it's also useful for the patient to be empowered also to communicate their care experienced with another healthcare professional. But that communication is extremely important.
Yeah, that makes sense. So in one of our classes, our pharmacology class, there's been quite a bit of discussion on if over-the-counter medications are really safe. Do you have an opinion on this from a pharmacist's perspective?
Yeah, I do. Safe is a relative term, really. So what might be safe for one person may not be safe for another person. So the idea of an over-the-counter medication, which is essentially a medication that doesn't require a prescription from a prescriber, may not necessarily be safe for all people. So as an example, someone like yourself, if you hurt your back or knee, you might take an anti-inflammatory for a month or so, and that's probably going to be safe. But if you have someone who's older, has maybe some kidney disease, high blood pressure, and decides to use anti-inflammatories to treat an arthritic knee or something like that, there can be significant harm from that anti-inflammatory in that sort of person. So usually I suppose the wisdom behind OTC medications is that they relates to reasonable access to a medication where people tend to self-treat. So there isn't typically engagement with a physician or a nurse practitioner to get a diagnosis. Someone experiences a symptom, generally a common symptom, and they're able to access a medication without having to go in and see a doctor and put more stress on primary care clinics. But the people do need to be aware, and this is a role for the pharmacist, to be using those medications appropriately, because they may not be safe in everyone. There'll be some medications that are called no public access, meaning you don't need a prescription, but you do have to go and ask the pharmacist for that medication. So those medications are typically more prone to causing harm, and so at least there's a bit of a step in there to ensure that the person has a conversation with the pharmacist around the safe use of that medication.
Very interesting. I think our class agreed with most of those things. So recently, laws have been changed around the topic of decriminalization of illicit drugs. What is your opinion on this?
Well, I'm not an expert in public health policy, but I still have an opinion. And overall, I think decriminalization is a good idea, or maybe stated another way, to criminalize the possession of small amounts of illicit substances is not a good idea. And I think the concerns that have favored the idea of decriminalization is just the impacts of becoming involved in the legal and criminal system for a substance use disorder, getting a criminal record, disadvantages individuals who are really wrestling with a medical condition, a substance use disorder. So it really probably does little but make things worse for the individual that is caught with personal use amount of a substance. Really where the criminal activity associated with drugs lies is in the production, trafficking, and sale of illicit drugs to people who are suffering with substance use disorders. So if there's going to be a focus around criminal activity, that's probably where it should be directed, and not downstream on the individual who is struggling with the condition for probably lots of good reasons related to the type of life experience that they've had. I'm glad that there's an evaluation period to ensure that there are no unintended consequences, and that there are some benefits from the decriminalization initiative. So let's hope it helps.
Okay, yeah, we'll have to see what happens. Do you have anything else you would like to share with our listeners today?
I encourage anyone to consider a career in the pharmacy professions. So we struggle for want of pharmacists and pharmacy technicians. We've recently seen a pharmacy technician program come to the island, which is great, and that is run out of Vancouver Island University, and it's in partnership with Selkirk College, who has an established pharmacy technician program. So we're looking forward to seeing graduates of that program find their way into employment with Island Health or other services that require pharmacy technicians. And yeah, otherwise, if you're up for a longer bit of schooling, then certainly encourage someone to consider a career as a pharmacist, because the role and scope of pharmacy practice is expanding, and I think will continue to be an important position in the healthcare community.
Yeah, I agree. All right, well, thank you for your time. That was lots of great information for our audience.
Thank you for the interview. It was lovely speaking with you.
If you're just tuning in, you're listening to A Sound Constitution on CHLY 101.7 FM, and that was an interview with David Forbes, the Director of Pharmacy for Island Health.
For our last segment of today's show, Cassidy is going to be telling us a bit about antibiotics and antibiotic resistance.
Antibiotics are used to slow the growth of or kill bacteria that cause infection and illness. When antibiotic resistance develops, the antibiotics normally used may not work as well or fail completely. Antibiotic resistance can happen naturally, but the inappropriate use of antibiotics in people, animals, and plants is increasing this problem. Antibiotic resistance occurs when bacteria become resistant to the antibiotics used to treat them, meaning the antibiotics are no longer effective in treating the infection. Antibiotic-resistant bacteria can spread easily among people and animals. The threat of this is that infections such as pneumonia, strep throat, or infections associated with minor injuries could become untreatable. To a certain degree, any antibiotic use can lead to antibiotic resistance. When bacteria are exposed to antibiotics, some bacteria with the ability to resist antibiotics will survive. Leading causes of increased antibiotic resistance are the overuse or inappropriate use of antibiotics in preventing or treating infections in people and animals. Examples of misuse include giving antibiotics to people and animals when they are not needed, taking antibiotics in ways other than how they're prescribed, self-medicating or antibiotic sharing, or taking antibiotics for viral infections, or an infection that is not caused by a bacteria. When prescribed antibiotics by a healthcare provider, it is important to use them as directed. This includes taking the correct dosage at the correct intervals and completing the full course of antibiotics as prescribed, even if symptoms improve before the course is finished. Not completing the full course of antibiotics can lead to the survival of bacteria that have developed resistance to the antibiotics, making future infections more challenging to treat. Only use antibiotics when prescribed by a certified healthcare professional, and never demand antibiotics if your healthcare worker says you don't need them. It is also important to practice good hygiene and take steps to prevent the spread of infection. Make sure to wash your hands often, practice safe sex, avoid close contact with people who are sick, and get vaccinated against preventable diseases. This helps to prevent the spread of infection and reduces the need for antibiotics. We can further reduce this need by making sure to prepare foods hygienically and choosing foods that have been produced without the use of antibiotics for growth promotion or disease prevention in healthy animals. By using antibiotics appropriately, practicing good hygiene, and raising awareness, we can prevent the spread of antibiotic resistance and ensure that antibiotics remain effective in treating bacterial infections.
That concludes today's episode. We'd like to thank our listeners for listening, and we hope you enjoyed this episode. We covered lots of topics about pharmacy, decriminalization of illicit drugs, overdoses, the dangers of mixing drugs, over-the-counter medications, how our body absorbs medications, the scope of pharmacists, and a little bit about antibiotics. And of course, I'd like to thank David Forbes, the Director of Pharmacy for Island Health, for being on our episode today.
For For details and show notes from today's episode, or to follow along with what's coming up this season, check out our Facebook page at A Sound Constitution, our Instagram at CHLY A Sound Constitution, or our Twitter at ASC_VIU. If you've missed part of the episode or would like to listen to other episodes from our past shows, check out our YouTube page at A Sound Constitution. Otherwise, we'll see you all again next week.